Good evening and welcome to the Ombudsman program. My name is Diane Welborn. I am the Ombudsman for Dayton and Montgomery County, and I'm going to be the host for this evening's program. Tonight our topic is an upcoming levy, the Human Services Levy, that will be presented to the voters. It is actually being presented now if people in early voting or absentee voting, so it's happening now. And we wanted to bring you information about the Human Services Levy so that voters can make their decision about supporting the levy. So I've invited a number of guests tonight who directly take the levy funds that come through the programs and assist individuals throughout Montgomery County in many, many different ways. And we're going to cover as many of those ways tonight as our short 60 minutes will permit. So I want to remind the viewers that this is a call-in program. So if you have a question about the services or about the levy, this is a time when you can call in and ask it. And for those of you who are later viewing the program and have questions, we'll get you a number that you can call after our hour together is over. So I'd like to go ahead and begin. I will introduce the guests and come back and we'll talk to them about some of the levy services. First, I'd like to introduce Commissioner Judy Dodge of Montgomery County. Thank you for coming here tonight. Appreciate it. Then I also have with me Nancy Banks, who is with Montgomery County Board of Developmental Disability Services. I hope I got that all correct.
Yes,
okay,
thanks,
good.
Diane.
And then we also have with us tonight Roger Loy, who is with Montgomery County Children's Services. Thank you for coming.
Thank you for having me.
Great. And we also have Helen Jones-Kelley, who is the director of the ADAMHS board, and that is an acronym for Alcohol, Drug Addiction, and Mental Health Services Board. And then finally, last but not least, we have James Gross, who is the director of Public Health, Dayton and Montgomery County. So each of these large agencies receives levy funds and turns those into services for people in our community, and we're going to talk about how. I'd like to hear from each of you really why the levy is important for your position or for your agency. So I'll just start with you, Commissioner.
Mm-hmm. Well, this is so critical this year. It's issue 11, so it's down on the ballot. So we want to make sure, we want to remind everyone, just keep going down, keep turning the pages because this is so critical, issue 11. The Human Services Levy, this particular one is going to bring in approximately $70 million this year. Over the years, many years ago, we had different levies for different things, such as public health, such as seniors, such as developmental disabilities, children. Back in the early 80s, the county commissioners, with a group, decided, we just can't keep doing this, having a levy every single year. Let's combine these levies and put them into what's called human services levies. So they run every 4 years. So that way God forbid we lose, at least we have then some money left. But this year it's very important. Over the years, because of the crisis that we've had back in the 2007, 2008, we've had to cut approximately $16 million from the levy, and we've had to cut about 200 positions. So our services have been hurt. But this year we are really pushing because it's so important to make sure. We've had 50,000, think about that, 50,000 of our residents here in Montgomery County get the services that are needed from the Human Services Levy. Now, that doesn't even include public health, and I know Jim is going to talk about their services. So it's very important that our citizens understand the importance of passing the levy this year.
Okay, well, thank you very much for that good overview and introduction for us. And I do want to kind of reiterate one point you made, that the issue is not the first thing that voters are going to see when they go to the polls or when they open their ballot. So people need to be encouraged to look for this. So great. Nancy, why don't you talk to us a little bit about the services, the importance of the levy to your agency?
Well, many of the services that our agency provides are funded by the Human Services Levy. Our early intervention program, which serves children from birth to age 3, is entirely funded through the levy. We have a recreation program that serves both children and adults with developmental disabilities that is funded through the program. Family respite care is provided through levy dollars.
Very important.
Very important to families to get that time away and get assistance in emergencies. And also our family home services is funded through levy dollars. In addition to that, we use local dollars as match funds to pull down federal funding for residential and vocational services for the people we serve.
Wonderful. That's fantastic. Roger, I'd like to hear about the impact with Children's Services, please.
Sure. At Children's Services, we use a lot of the levy funds to meet the needs of the most vulnerable children in our community, those who have experienced abuse and neglect. We do that through providing in-home services and trying to preserve those families as much as possible. If that's not possible, then we look for kinship, and our levy funds do help fund some of our kinship placements as well as our foster placements. On the other end of the spectrum, our levy dollars are used to help parents who choose to adopt in order to help maintain that child in a permanent home on an ongoing basis. Just like DDS, we levy our dollars that we receive from the levy and match those with federal monies. So every levy dollar we get, in essence, turns into $1.52. So that's very important to us and very critical for our services.
Good, thank you. Helen, talk to us about the ADAMHS board and the levy.
Well, Diane, you know, you can't open a newspaper these days and not see something about mental illness or addiction. And our services are key to the community because we provide the planning and funding and the purchase of services to address issues of addiction, mental illness, and substance abuse is a huge issue for us right now. The problem we face is stigma. You know, we are called the behavioral health system, and that's something of a misnomer because nobody chooses to get up and feel the way that many people do when they're addicted to substances. We're talking about brain disease and really trying to provide the kind of supports and medication-assisted therapies as well as counseling and other community services that allow people to live lives that allow them to be self-sustaining citizens. And it's key to us to be able to provide that for 1 out of 8 of our citizens across our community who need those kinds of services, who are grappling with mental illness or substance abuse.
That's a large percentage.
Large percentage of our citizens.
Thank you. And Jim, Public Health in Dayton, Montgomery County, you have a wide array of programs.
Well, we have about 70 different programs, Diane, and all of those programs to some extent are funded by the Human Services Levy. Roughly half of our funding comes from the levy. So if you're talking about immunizations, which right now our immunization group is extremely busy dealing with everything from the flu to answering questions about Ebola, which is right now on everyone's mind, I think, worldwide. And in fact, we just launched a hotline for our citizens here in Montgomery County so that they can call our hotline to get answers about Ebola. We wouldn't be able to do that without the Human Services Levy. Other programs that we implement include all of our food service programs, air pollution control, prenatal services. We also subsidize some of the clinics that serve our most vulnerable population. So when you take a look at our 70 different programs, not only is it the 50,000 people who Commissioner Dodge spoke of, every single person who resides in Montgomery County, all 530,000 of our citizens benefit from some of the services that we offer here at Public Health. For example, if you went to any of the festivals this fall, we inspected every food booth that was at every single one of those festivals. And in fact, we do about 10,000 food service inspections each year. So everyone in Montgomery County benefits from public health services, and we couldn't do what we do without the Human Services Levy.
All right. Well, thank you for that fine overview. Commissioner Dodge, can you tell us a little bit about the levy services that are going specifically for senior citizens?
Yes, we, of the amount of money that is brought in from the levy, close to $10 million goes to just seniors. And a lot of that is distributed through the Area Agency on Aging. And, you know, so many seniors now, they want to stay in their home. They do not want to go to a nursing home. Mm-hmm. So this provides funding for seniors such as housekeeping. Perhaps they're too ill, they cannot take care of their home. Food. perhaps someone could come in and deliver food to them, as well as Meals on Wheels that comes through the Senior Resource Connection. All sorts of services, as well as even a health aide that would come in and perhaps change dressing on their leg or something like that. And it makes such a difference because, again, these seniors, they can't afford to go to, a lot of them, to go to a nursing home because, as we know, how expensive they are. And they want to stay in their own home, but they don't have relatives that can take care of them. So this is a wonderful thing that the Human Services Levy does provide, and that is keeping seniors in their home. Another thing that we grant money to would be the Alzheimer's Association for respite care for the caregivers. Also the Legal Aid Society, because a lot of these seniors do have legal questions and concerns, and we help with that too. So, I feel that, it's a wonderful, wonderful program that basically takes care of our seniors, and that's the important thing.
All right. Well, thank you very much. While those are programs that are specifically targeted to seniors, I wouldn't want to leave the impression that all of your agencies would be serving seniors in some way. Would you like to comment on that?
Actually, DDS provides a lifetime of services from birth all the way up through adult senior care. So we too offer help for seniors with developmental disabilities.
Okay, thank you. And Helen and the ADAMHS board, their seniors served that population as well.
Absolutely.
Yeah.
When you think of people aging and depression issues that occur as they begin to lose friends, or some of the issues around loss, suicide prevention is one of the services we provide. There are a variety of things that happen with people who are aging, who are isolated, and we're able to provide some planning and services for them as well.
Okay. And Jim,
I can think of 3 public health services that serve our senior population. First is we actually do run a home care program that serves our most vulnerable citizens. Oftentimes it's for a health care need that is in very short duration, but they don't have any other people who would take care of them. So we go into the homes and actually provide those home care services. Secondly, we do provide subsidies to some of the clinics that also serve our most vulnerable population with regard to the primary health care. And then third, and it's actually, I believe, a service that many people do not even understand that we provide, but it is a growing program, and is that we provide vaccinations for overseas travelers. So when people need to go to foreign countries and need a specific vaccine, we actually provide that service out of our office at the Rival building.
Okay, well good. Thank you for adding that in. Back to Commissioner Dodge, I was going to ask if you could say a little bit more about the schedule for the levy. You talked about how it was combined into one levy, but then it is split into two. And over what period of years do the voters have a chance then to come back and vote on the two parts of the levy? And is an equal amount of money raised with each one? And I'm sorry, that's enough questions at one time.
That's okay, yeah. It's every 4 years.
Okay.
It's on the ballot. The term of the levy itself is 8 years, but we've broken into Levy A and Levy B. We're voting on Levy A now. We voted on Levy B in 2010. We were very fortunate. It passed by over 70% of the total voting population. So we're very happy because, we know that here in Montgomery County, our residents are loving and understanding of our vulnerable population, and they step up, no question about it. But it's hard. It's hard. This year, we have asked for a $1 million additional. To someone who has a $100,000 home, that's going to be about $3 a month. So we really could use more, but we know that everyone is going through some hard times. So we decided $1 million was enough. So
okay, all right, very good. And do other counties in Ohio, have they combined their levies in the way that Montgomery County has?
No, we're only the second county in the state of Ohio that does it this way. Now, I have personally received several calls from different county commissioners throughout the state saying, how did you even do this? This is such a great thing. Because every year when you have a levy on the ballot, you have to raise money to be able to get the ads out and the promotion to get the citizens to understand what's going on. So this is great. We only have to do this every 4 years. Thank heavens.
Right, and that's good for the citizens too. As they're going, they know what they're voting on and they know how much it is and that it's going to come back. It's not going to come back and visit them
'Cause there's
every
such a
single year.
Exactly. There's such a thing as levy fatigue, and we don't want that to happen with the Human Services levy.
Right, absolutely, we do not. And you've already mentioned that it's going to cost about $3 a month for
a home that's valued about $100,000.
Okay, and that overall increase will bring us how much
Approximately about $70 million.
Okay, altogether.
Yeah.
Okay, that's a very good then. And when would the payments start?
They will start at the end of this year. It'll start in January.
In January.
So whenever your next tax bill comes, it'll show on that.
All right. So it would begin. It would begin in January then. Can you speak a little bit to how some properties in Montgomery County have lost value? Some others may have stayed the same or even increased. But how do you anticipate that some of that loss of property value is going to impact the funding available for all these important services?
Well, and it probably will. You know, we're not able to collect here in the county 100% of all the value of the taxes. So usually they consider about 95% is what they can collect. So unfortunately, we're saying 70 million, we may just get 65 million. So right now they're going through a board of revision, and people are coming in and either saying their value's too high or too low. So because if your value is lower, they're not going to get the same amount of money collected from that.
Right.
So.
And so that's still in process.
Yes.
So we don't really know
don't really
exactly
know. Yeah.
and won't until that process
Right, exactly.
has actually run its course.
Exactly.
Okay. Well, you mentioned earlier too that there were total reductions in staff and in funding through across all the agencies. So now I'm going to ask each of you to talk a little bit about how your agency handled that and what changes were made. So I'll start with you, Roger. If that's
Sure.
Okay.
At Children's Services, during the last several years, we had to stop hiring. When people left, we absorbed their workload. We've done that for several years, which has increased the caseloads of all of our workers and our staff, which makes it a lot harder to do the job, a lot harder to protect the children, a lot harder to get out there in a timely manner. So with the additional levy funds, we should be able to get our caseloads down, be able to be more responsive to the community that we serve.
All right, very good. Helen?
Well, we don't provide any direct services. We purchase those services throughout the community. And one of the things that we've done over the last several years is really build in an accountability system. The human services levy dollars that we receive at ADAMHS need to be the payer of last resort. And so we have been working with our provider agencies to help them deepen their penetration rates with Medicaid. There have been services that we were paying for with levy dollars that were available to be reimbursed through Medicaid. So that's one of the areas we've worked really strongly on, which then frees up the local dollars to either buy innovative new program services or to pay that last resort where there is a gap between what Medicaid will pay and what we will pay in order to have the services available in the community. Okay. We've also looked at programming and performance measurements in a way that we haven't before, so that as we are purchasing those services, we're expecting outcomes, we're buying results, and we're really paying attention to that so that we're looking at capacity within our provider system so that we're really building the excellence of the system overall.
Okay, well, thank you very much. I'm going to come back to you, Jim, on that, but I've been told that we have a caller, and so I would like to hear the question that the caller has. Go ahead, please. You're on the air.
Yes, this is a wonderful program. Thank you for doing it. The Human Services Levy is so important to our city and our county. My question, which I suppose is for all your guests, arises from my concern and also my hope for our young people. In a time of increasing infant mortality and public schools that are not adequately funded and continuing economic struggles, my question is this. Which aspects of the Human Services Levy are most decisive for our young people?
All right, thank you very much for that question. We will get you an answer from each of our guests. So we'll come back to you in a minute about the impact of the cut. Well, why don't we do that now? Let's go ahead and do that now, and then we'll get the caller's question answered. Go ahead.
Starting about 7 years ago, we realized that our funding was going to probably be reduced over time, so we began to take steps at that time. In fact, we went from 400 employees to 275 that we have today.
And that's a large reduction.
It was a very large reduction. Those weren't all layoffs. Similar to what Roger said, you know, when you have an open position, sometimes you just don't fill it. And that was the mode that we've operated in for about 7 years. And what we did was we wanted to make sure to minimize the impact on the citizens. So when we transitioned programs, what we did is we sought out community partners who offered similar services, and then worked very hard to try to make sure that the citizens who were coming to our programs actually transitioned to the community partner to still get those much needed services. And that has worked. You know, for example, we closed some of our child clinics, but the community health centers of Greater Dayton here in Montgomery County had some capacity, and that they are now seeing the children. So the community is still served, but we've reduced the draw on the human services levy. So it's just a different way of running your business. And if you can run the business in a way where the citizens are still served, then that helps everyone in the community because it minimizes the draw then on the levy.
All right. Well, thank you very much. And each different approaches and very interesting different in the differences that were chosen. Our caller had an interesting question about young people, and he was curious to know what levy services impact young people, and specifically, I believe, young people succeeding and moving forward. So I know that all of you touch young people. So I'll just start with you, Nancy.
Well, as I mentioned earlier, we have an early intervention program that specializes in helping infants from birth to age 3. We have developmental specialists that go into the homes and the natural environments for children who have delays, and they work with the child and the family to teach that family how to help that child develop to their fullest potential. They also determine what the plan for that child is from the family, what the family's needs are, what their priorities are. And those type of supports really help children to catch up from the delays and to meet their highest potential.
All right. Thank you very much. So children, your agency's all about children.
It's all about children, but I think some of the most innovative things we're doing with children right now is we are working with the children that we are involved with, and making sure their educational needs are met. And we have set up some specialized services for that, where we have liaisons with children. We're very involved in the 3rd grade reading standards and making sure our children that we work with pass those. We send folks into their homes to read with them. In conjunction with the county, we go to a couple of the local schools now almost every day of the week and read to children who are behind in school, trying to get their test scores up. We started this last year. It was phenomenal how much their test scores increased in the time we worked with them. So those are some of the more innovative things that we've been doing in the last year or so with the children we work with.
Can you speak a little bit more about the improvement in the test scores as the outcome of this innovation?
Well, I think last year we had 12 3rd graders that we worked with, and all but one of them passed the 3rd grade reading test. One of the other child did not need to take it because they had an IEP, so they weren't required to take it. But the other 11 that we worked with did pass it, whereas the first time, none of these children had passed it. So we were able to work with them to get them to pass that.
That's pretty dramatic impact.
Yes.
Congratulations. Good. And Helen, with young people within the system, helped.
When you think of us with a continuum of care, our services fall within 3 general areas. Prevention. So when we talk about young people and prevention, we're working with agencies to prevent them from becoming addicted to substances, as well as trying to work on mental health prevention, which many people don't understand that we can do. We look at ways to reduce trauma to young people, as well as doing mental health first aid, working with our educational systems and other systems to identify what they see in a child's behavior and to be able to put strategies in place to address those early on. We also work in the areas of treatment and intervention because we have young people who unfortunately are addicted. We have young people who are grappling with mental illness, and we provide the services that they need. A special program we're doing now is Peace Packs, where we're working with the schools to help them reduce bullying behavior and to learn how to be good citizens and get along with one another, which is a really interesting program. And then we do work with law enforcement in the courts for those young people who have gotten to the other end of the spectrum, and providing assessments and services so that we can get them back on track, reduce the negative behaviors, as well as reduce the likelihood of ongoing substance abuse and other ills that they may be grappling with over time.
Nice. Thank you. Nice. And you mentioned prevention and thinking that maybe not a lot of people know that that's a role that the ADAMHS board is playing through Levy-supported funds. Would you like to elaborate a little bit more on that?
Absolutely. In fact, we just launched a large community-wide prevention initiative last week where we're bringing people together on a monthly basis to talk about areas where we can put resources. And most of that's really our thinking. How do we work together to better provide a network, a safety network for young people and for adults in our system who may fall into the abyss of abuse, neglect, I'm thinking of your stuff. But that shows how we work together, because we have also a system of care grant that we just received, also a prevention grant to look at how we serve young people, as well as some of the kids who are in foster care, especially because we don't have enough mental health services. This will allow us to be able to offer services over a 3-year period, utilizing the levy dollars, leveraging our local dollars to bring in some federal dollars to really reduce both mental illness as well as some of the issues around prescription drugs with our young people. We have a lot of kids in foster care, for example, who are on a variety of prescription drugs, and we're trying to reduce that reliance on drugs and to do more in the area of prevention work and behavior change that allows them to be able to get on with their lives without it. So there's a great deal of collaboration that is occurring as well within those realms.
It's a very strengthening factor, I think.
It's exciting.
And so, Jim, with the young people succeeding.
I would like to talk about 2 programs. One is an extension of our healthy lifestyle program. It's called Get Up Montgomery County. Right now we are focusing on daycare centers. And right now we have 52 daycare centers that are working directly with us to try to help their young students with healthy eating and active living. We know if we can make those impressions on that youngster at that age, they are much more likely to carry those habits as they grow older. And if they can continue to do that for a lifetime, they will be less likely to develop really a lot of the chronic diseases that's killing all of our citizens prematurely today: cancer and heart disease and stroke and respiratory disease. So healthy living is really a big focus of ours that the Levy is supported, and Get Up Montgomery County is our flagship program there. The second program I'd just like to mention, because the caller mentioned infant mortality,
Thank you.
is that over 2 years ago we brought together community partners to take a look at infant mortality in Montgomery County. Our rates are embarrassingly high, not only here in Montgomery County but through the entire state of Ohio. And the racial disparity in infant mortality, quite frankly, is embarrassing. Black babies in Montgomery County die at 2.5 times the rate as white babies. So what we did, again working through partnerships, is that we worked with the local hospital association and brought together a coalition of about 35 members. And I'm happy to report, here we are about 2.5 years later, that we are going to be initiating 2 initiatives here in Montgomery County, again working with partners who actually deliver babies, because we don't deliver babies. But it was our job to bring people together. And again, that's one of the beauties about the Human Services Levy, is that it gives us the opportunity to bring together partners and have people work together in an efficient way to serve our citizens. So I'm really excited about the 2 initiatives with regard to trying to mitigate our infant mortality. And we've actually been recognized for what we're doing here across the country. There's been only 4 cities that were chosen to be part of a national effort that's going on, and we were one of those 4. So We're excited, we're embarrassed that we're in a position we're in, but we're choosing to look forward and not backwards, and I think before too long we'll start to see those numbers go down.
Oh, well, that's good. Well, I'll be happy when that happens. I would like to ask then each of you to say a little bit about what has changed with the population that you all are serving since the last levy in 2010. Are you seeing increases in services? Are you seeing different needs, or are things the same? I'll start with you, Nancy. What over time?
Well, I can tell you that right now our figures show us that we have 241 caregivers over the age of 60 still caring for their child at home, their child with developmental disabilities. We also have 6 caregivers in their 90s still caring for their family member at home. So we know in the near future these families are going to need either additional supports in their home or placement out of home, and we want to be able to help them out and make sure that their loved ones have the proper place to go or have the support that they need in their home.
All right.
So
and what kind of steps are you all taking with those plans?
Well, we're working on more community-based housing.
Okay.
And actually we are starting to serve more folks with either intense medical or intense behavioral challenges. And with the federal government has a push to make sure that people are served in community-based environments. So it's becoming more important for the local dollars to help with housing for individuals with disabilities.
Housing. Thank you very much. Roger, over the past 4 years, what trends or differences have you all seen at Children's Services?
I think the biggest trend that we have seen is the popularity of heroin in our community and the effects that that has had on the young children and the children of those families. It's presented a particular problem in trying to find resources for those families. We do turn to ADAMHS a lot and to other community providers to help us with that. Our job primarily becomes making sure those children are in a safe place and trying to find relatives and trying to get them the proper treatment that the children need for the trauma they've experienced. The amount of trauma to these children are traumatic. It's very disturbing to see that.
All right. Thank you. Sorry. Helen.
As Roger mentioned, the heroin issue for our community has just really been significant. And for us, we're trying to grapple with addressing that, but addressing it in the right ways. Nancy mentioned housing. Housing is big for our system as well because as we get people into treatment programs and then bring them back into community, they need to have stable housing. So that's an area that we had not been attending to before because it wasn't our thing per se. It's our thing now. We have to be able to get people into stable housing and we have to get them connected to employment. And so that as they're getting their children returned to them or they're getting back out in community, they're able to maintain themselves. The other area for us that's huge is the increase in women who are drug addicted within our community and providing services that are gender specific now in ways that we may not have in the past.
All right, so housing also across all of these programs. What changes, you mentioned a little bit what you're doing positively on the issue of infant mortality, but what changes have you been seeing for public health?
I'm sorry, Diane.
Go ahead.
Actually, I'm going to start off by saying heroin.
Okay.
And I'm not saying that to be funny.
Well, we've just got a unanimous opinion here. Yeah.
I'm saying that to emphasize the importance of that issue. You know, we all play a role in that. Right. And, you know, several years ago we contracted with Wright State to take a look at the information around these people who were dying. And in 2010 we had 127 deaths, and then next year we had 130 deaths that resulted from overdoses. The year after that it was 162, and then we were at 226, and we're going to be more than that this year, I believe. So, you know, the heroin issue is impacting everyone in our community, either directly or indirectly. No one's free from it. And it impacts all of our organizations as well. So I'm going to mention heroin, you know, again, not to be funny, but it is so impactful for all of us. But also another one is communicable diseases. Communicable diseases, I believe, are on people's mind a lot more now than what they used to. And I believe 2009 when we had H1N1, and everyone was scrambling around trying to find vaccine, and public health was actually going into schools to vaccinate children, and then we were holding these mass clinics at Hare Arena and UD Arena and even a vacant cinema down in Centerville. I think that was the beginning of people really realizing that we're probably in a new world now, and I'm going to use world because I think the transportation is different now, and people travel from country to country. And in recent years, not only have we had H1N1, we've had tuberculosis outbreaks here in Montgomery County. And now we have enterovirus, and sadly we're dealing with Ebola now on a worldwide basis, and now, in the United States. So I believe people are more interested in communicable diseases than they should be, because oftentimes we can do a lot ourselves to prevent the spread of communicable diseases. Simply by washing our hands is probably the most important one. And that's not new for public health, but I think it's a renewed emphasis that we're all dealing with. And we all have a part to play in the spread of communicable diseases, and that's why we're really emphatic about people getting their flu shots. And we want sick people to stay home and not come to work. And I believe we're beginning to make some progress there. But I do believe the entire world is in a different situation now with the spread of communicable diseases, just because we travel so much more.
Very important point. Thank you for bringing that up. I appreciate that. I'd like to give also each of you an opportunity to tell or share with the viewers a success story that the Levy has helped support, something that they may not have read in the paper or seen or heard about, but something, a good individual kind of case study that's come from one of your agencies, just to illustrate for people how lives can be helped and improved by the Levy funding, what it means to the individuals. Roger, I'll let you go.
Well, I'd like to talk about a gentleman, we'll call him Ray.
Okay.
And Ray is a 16-year-old boy who's been in foster care since he was 5. And Ray has a lot of issues. He has a lot of mental health issues. He's developmentally disabled and has needed a lot of care through the years. And because of his aggressive behaviors, moved quite a bit. In fact, from age 5 to age 15, he moved 34 times. And I sort of felt like we lost Ray. But then we started working with some collaborative agencies, and we found not an adoptive home, but a forever home for Ray. Someone who said, we know his issues, we know they're challenging, but we're willing to take it on, and we want to be there for the rest of his life. And Ray had his 16th birthday about 2 weeks ago, and he was able to celebrate it with a family. That is significant to me. And to be able to see his face change, his demeanor change. He still has lots of challenges and will. But now he has a family, and that's important.
Yeah, very important. Thank you. Thank you for sharing that. Good luck to Ray.
Yes.
Okay. Helen.
I'm going to share with one of our board members who happens to be a consumer on our board and openly shares her story. She spent 30 years with an addiction issue, 30 years. And one of the biggest barriers to recovery is stigma. And it's burning bridges, and it's not having a place to have a permanent address, those kinds of things. So she has experienced every aspect of the downside of the system, but because the system didn't give up on her, and there were services available to her, and there were people who refused to give up, she was able to overcome and to be in full recovery now for a number of years. She now owns her own business. She is such an advocate for services, and she is able to bring the message of hope and recovery to the community. She's now a very important member of our board and is able to help us reflect on our policy and how well we serve people who are in recovery. It's a wonderful story because it just proves that people can recover, treatment does work, and once we get people recovered, then they go to work and they're able to be successful members of our community.
Right. That's certainly a model that for
Great
so
model.
many other people to be able to follow. Thank you for sharing. Jim.
We normally deal with populations or subpopulations, so I'm going to vary a little bit from the individual
Fine.
stories. When we conducted our health assessment, the first health assessment back in 2011, one of the priority items that were chosen to be dealt with in Montgomery County was dental services. We often hear about the lack of health care, but it's not always realized that we have really a dire need for more oral health services here in Montgomery County. So again, we brought a group together to look at ways that we could enhance the dental services in our community, and we actually went in two different directions. And currently, we now have dental services at the East Dayton Health Center that's run by the Community Health Centers of Greater Dayton. And years ago, there were dental services offered at that facility, but they've been vacant now for about 5 or 6 years. So we were able to restore dental services at East Dayton Health Center. So people who have not had dental services for years are now seeing a dentist at the East Dayton Health Center. And then the second population are our children. And a prevention program that's been run by Miami Valley Hospital for a long time actually puts dental sealants on children's teeth in the school-based setting. So that's very convenient for the parents or the grandparents, that the sealants are actually applied in the school. And they are extremely effective in preventing cavities. And what we did was we provided the resources for Miami Valley Hospital to double the size of the program. So twice the number of kids in Montgomery County are now having dental sealants applied to their teeth. I don't have a specific name for you, and if I did, I'd probably be violating a HIPAA rule. But I can tell you that there are many more children now receiving dental sealants in our schools, and we have both children and adults now getting dental services at the East Dayton Health Center.
Well, wonderful. That's a great benefit from the levy. And Nancy?
Well, I'm going to go along the same lines as Jim and talk in a little bit more of an overview in general terms. We offer respite care for families. Frequently, you will have family members who are caring for their child in their home. They may have a health emergency themselves. They may have to be hospitalized. They may have to have surgery. They may have to travel out of town for some reason, and they need assistance to make sure that their child is taken care of while they need those services. So that really helps these families to deal with the stress that's going on with their lives and helps hold families together. Another program, our recreation program, we have specifically a program that serves some younger children that have some pretty challenging behaviors. We have programs that they can attend on evenings and weekends, and it kind of gives families a break. Some of these families have other children that they need to spend time with. Spouses need to spend some time together. They have other responsibilities that they need to take care of. So that time away is really important and really helps preserve that family.
Oh, wonderful. That's great for the respite services. Thank you. I'd like to turn a minute now, running out of time, but I'd like to ask a little bit more about the work of the Levy Council, because I think that that may not be something that often gets described a lot. But we have a Levy Council, and maybe you could tell us a little bit about the type of individuals that serve on that council, and a little bit about what they do, because all of these agencies need money, and there's additional ones that aren't represented here. So how do they decide how much people get? So tell us about that process.
Well, everyone here, I'm sure, has been in front of the Levy Council one time or another. There's, I believe, 15 or 16 individuals that serve on the Levy Council, and they are made up of business leaders, financial experts, and community volunteers. They take this job very seriously. They work very hard. And what they do is they make sure that all the agencies are, their finances are okay. They look at exactly what their needs are, what their expectations are, what they need for the next several years. They hold them accountable to their money as well as their services. And they do this quite frequently. What they do then is this past year or so, they basically have taken all that information. They sat down and then they make a determination and a recommendation to the county commissioners as far as what the needs are, what the levy should be, whether it should just remain the same or it should be increased. Then they take that recommendation and talk to us about it, and then we decide, we make the final determination whether or not to put the millage, additional millage on the ballot, and that's what we did. They came to us and said the need is great, and but we just recommend 1 mill increase. So,
Okay.
so we're very proud of the council because, as I said, we all know them and they work very hard.
Right. And what is the process that they use to determine the amount of funding for the various agencies that are here?
Well, as I said, they come in front of them and they
Okay.
do their projections as far as what they need, and they look at their financials, and just we all, they all sit down and decide this is what it's going to be.
So there are presentations that each of you all will go and
yeah.
you'll make to the Levy
Exactly.
Council and talk about what your needs and your
Yeah.
budgets and all of that. I'm sure that's not an easy discussion
No.
to have. So, all right. Well, we're closing in on it here, but I did want to get at what you would anticipate the impact to be if the levy did not succeed on the people that you serve, and what your agency would have to do. So this is like the worst case scenario. Nancy.
Well, we would have to look at each different service area and make a determination whether to reduce services, eliminate services. We would also have to look at mandated versus non-mandated services.
Okay.
I can tell you a personal story, kind of. We have self-advocates that are in our work centers. And when the levy campaign started, some of the self-advocates came to me and said, this levy is for us, and we want to be part of it. How can we help? How can we be part of the campaign? And they have talked over and over again about how important this levy is to them and what a wonderful life they have because of the services that they receive from the levy.
Okay. So they are involved in
They are
that
involved.
self-advocacy to get that
Absolutely.
done. Thank you. Roger.
Well, just like DDS, we would have to look at those mandated services because we have to maintain those. Beyond that, we would seriously have to look at what other services we can cut. Unfortunately, in our agency, the biggest portion of our budget goes towards the placement and helping pay for the keep of children. It's hard to make those cuts there in a safe manner. So, but we would have to figure out what we can do without.
Okay. All right. Thank you, Helen.
It's the same for all of us. We'd be looking at mandated versus those discretionary services that we know are the right things to do and that
Right.
really make a difference. In our case, we're bringing a couple of new programs online that we really think are important. We wouldn't want to have to lose, but they would probably, because, last in, first out. We have a detox program we're bringing online. We have needed for a number of years to have detox services available within our community so that if law enforcement picks someone up, they can bring them to a place where they can sleep, and then we can get them connected to services. We shouldn't have people on the jail floor going through a detox. And that's an important program that we'd lose as we're bringing online. Another one relates to our young people. We have a lot of young people who are living on the streets or in their cars or bouncing from couch to couch. And we've put some programs into place to support them with transitional housing. It's not a mandate, but it's the right thing to do for these young people to bridge them. These are kids with severe mental illness. Those are the kinds of things that are not in a mandate and that would be part of a decision as we look at the priorities and then the requirements of our limited dollars, and that it would just be the wrong thing to have to do.
Right. Thank you. Jim?
The levy provides half of our funding.
Oh.
So I can't tell you what we would do. The analogy I would draw would be if a family lost 50% of their income, what would they do? Their mandated services would probably be food
Yes.
and shelter.
Yes.
And beyond that, it's very difficult to really say beforehand what it is that you would, be able to do. Most of our costs are in our people. It's about 75% of our costs are people costs. So if we were to lose 50 cents of every dollar that we have now, obviously we would have to cut our staff. And when you cut staff, then you cannot provide the services that we're providing today. So it would be devastating. We do have mandated services like everyone else, but beyond the mandated services, quite honestly, I can't tell you today what we would do, but it would be devastating on what we would be able to provide versus what we do today. It would be traumatic, I think, for our community if not only in public health, but if all of our organizations suffered a levy loss. I don't know how we would continue to do what we do.
Okay. Well, I do not want to end this program on a worst case scenario, although it's important to talk about that. It really is important to get that out there, I think, because there's a lot at stake. Where can viewers go to get more information if they're seeking it?
We have a website, www.protecthumanservices.com.
Okay.
www.protecthumanservices.com. It all runs together. There's no space.
No spaces.
And there, it's dropped down, and it to tell you volunteer. You know, if you want someone to come to speak, whatever you want, it's that information is right there.
Okay. And if somebody wants to do some advertisement for it, or if somebody wants to invite a speaker to come to a group, would they also be able to find that on the website?
Yes.
They
Yes.
would.
It's all right there.
Okay, that's great. Do you have any closing comments for us?
No, 50,000 of our most vulnerable citizens here in Montgomery County are in drastic need to make sure that this levy passes. It's issue 11, and I would urge all of our viewers here to please, if you have any questions, go to the website. And please go and vote for this, because this is so important. 50,000 people, that's about the size of the city of Kettering.
Yes.
Think about that.
Yes, that's
And I'm sure you've heard from everyone here what the needs are. So.
right, exactly. Anyone else need to chime in last before we say goodnight? Okay, thank you all for coming on the program tonight. We appreciate your coming and talking to the viewers about the levy, what it means to your agencies and to the people that you serve. Thank you very much. And thanks to the viewers tonight. We appreciate your watching. Good night.